She is a family physician and head of primary care advancement at Elation Health, which is a primary care focused electronic health record platform. Sarah is also a direct primary care physician at People Centered Health, and it's my honor to invite Sarah to the stage.
Thank you so much, Netta. I really cannot believe we are all here. Guys, we did it.
Yes.
It's not in my scripted notes, but I really want to recognize the efforts of Netta and the planning committee, and of course our fearless leader, Dr. Michael Fine, for all of their efforts in putting this together. Our inaugural summit, Netta being our inaugural executive director. So this is a movement that's picking up steam, and I'm really proud of everyone who's contributed to it. So big round of applause. And welcome everyone. So before we begin, a few more housekeeping notes, or compulsory housekeeping notes. We will have a morning break. Lunch is at noon. Afternoon break. The breaks are short, so make them mean it. And then in the afternoon, we'll be having something called table talks. And during the table talks, you'll be able to choose 4 sessions to attend and rotate every 20 minutes. Rotating is not mandatory. You can stay, but if you want to rotate, that's every 20 minutes. And the full list of table talks is included in your program. Today's agenda moves very quickly, and so we ask that everyone return promptly after each short break, and that will help us protect time for every speaker and discussion. This morning is designed to move from evidence to action. We'll begin with the case for primary care, what the research shows, what communities already know from lived experience, and what happens when people cannot get timely, continuous, relationship-based care. We will then recognize with some awards leaders who have advanced primary care through different forms of public service, legislative leadership, moral courage in medicine, and sustained commitment to community and community health. Those recognitions are part of the message of this day. System change requires evidence, but first and foremost, it requires people and their communities to act. From there, we will turn to practical tools and models. We will look at how communities can measure local barriers to primary care access through community primary care reports. We will hear about community health centers, direct primary care, payment reform, and policy levers that can help move primary care from aspiration to infrastructure. The through line here is very simple. Primary care is not just another healthcare service. It is the most important part of healthcare because it's built around the relationships people have with one another. It is the front door, but also the place where prevention happens, where chronic disease is managed, where trust is built, and where people are seen and heard as human beings. And this happens before their needs become emergencies. When primary care is strong, communities thrive and work better. When it is neglected, patients wait longer, clinicians burn out, costs rise, and inequities deepen. To start us off this morning, we will hear from Dr. Michael Fine, board president and founder of Primary Care for All Americans. Michael has spent his career making the case that primary care is not simply a clinical service, but a public good and a critical public health process, that primary care for all of us in every neighborhood and community is the only pathway to affordable health care, a healthy public, and a healthy democracy. He will open today by grounding us in the evidence. What primary care makes possible, what happens when people cannot get it, and how communities can build the power, partnerships, and practical strategies needed to ensure that every person has access to primary care. Please join me in welcoming Dr. Michael Fine.